Okay, hello everyone. It's just about noon, so we're gonna get started here. Just getting my window sorted. All right, so my name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department, and I'm coming to you today for another segment of Numbers with Nick. We're gonna talk through some numbers related to the new variants that have been identified in Rock County, but have been circulating in Wisconsin and elsewhere in the country. We will always have time for questions at the end. If you have questions throughout the stream, feel free to put those into the chat and we'll try to answer questions at the end if anyone has any questions. And as always, you can always send us questions via social media and we can answer those either directly or we can answer those questions on a future video. So without further ado, I'm going to pull up my screen here and just give you an idea of where we're at in the pandemic with respect to the number of cases that we're seeing most recently. So as of yesterday afternoon, we have gotten reports of 15,416 total confirmed cases of COVID-19 among Rock County residents. There have been 167 deaths due to COVID, and many people have recovered from their illness. So 14,883 people of the 15,000 some have recovered. So right now we're looking at about 366 active cases of the disease in our community. So right now we're continuing to see kind of a pretty regular number of people testing positive for COVID-19. I'm going to scroll down here and take a look at the trends over time. So what we're seeing is this first graph on the top left is the number of cumulative positive results that we've seen over time. And at the kind of in January through February, we were seeing kind of a leveling off of our case activity. And that's when the curve kind of becomes more flat instead of steep like we saw in the fall in September, October, November, that time period. And most recently, kind of in March and April, we're starting to see a little bit more COVID activity and regular increases in the number of new cases that are being reported to the health department. So we're seeing a slight uptick most recently. I think right now we're averaging about 30 new cases per day on a weekly basis. And those numbers, I believe, have kind of stabilized somewhat. So we're not seeing ongoing increases as we were in the fall, but we are seeing still a large number, relatively speaking, a large number of Rock County residents who are still testing positive for the virus. And when we look at our active cases, this is the graph with the black line here, we certainly don't have as many active cases as we did in the fall and in November and December in those months, but we are seeing again an increase in the number of active cases. So our low point here was right at the beginning of March, we were seeing about 160 to 170 active cases. And since that time, we're up to about 366 active cases. And so that means that as there are more people who are testing positive in a shorter time frame, there's a higher risk of the disease to spread among the community. So more active cases means a higher risk of spread. On the flip side, we are seeing pretty good numbers in terms of our vaccination efforts. So we're seeing ongoing increases in Rock County residents who are getting vaccinated for the first time, and also Rock County residents who have completed that vaccine series. So as of yesterday, we had 58,500 residents having received at least one dose of the COVID vaccine, and about 42,000 residents have completed the vaccine series. Now, this graph shows the number of people who are currently eligible. So we have about 128,000 Rock County residents who are currently eligible for the vaccine. So we still have a lot of work to go in terms of getting as many people vaccinated as possible, but the increases are encouraging as we're seeing more and more people getting vaccinated, and not as many people having severe illness due to the vaccine does provide some protection for individuals who are fully vaccinated. They're much less likely to be severely ill if they do end up getting sick from COVID-19. So I want to switch gears a little bit and talk about the variants that are emerging. So we sent out a little communication yesterday indicating that we have identified a couple additional new variants of the coronavirus in Rock County. And so as of Today, there has been the identification of the variant called B.1.1.7, which is the UK variant. There's been identification of the B.1.3.5.1 variant in Rock County, and then the P.1 variant. And I just want to check and make sure I have this right. So the P.1 variant is the variant that was first identified in travelers coming from Brazil, and the B.1.3.5.1 variant is determined to be from South Africa. Now, the reason that we want to talk about variants is that these variants that have been identified are shown to spread more rapidly throughout the community. So when we have our previous variants there of COVID-19, they were a certain level of contagious in the community. And so when we have these new variants that are more contagious, there's more risk of the disease spreading across the community more rapidly. So that's why it's very important, as we're still kind of in the phase of getting everyone vaccinated, we want to make sure that we're continuing to practice mask wearing and social distancing so we can prevent the spread of these variants. In terms of the B.1.1.7 variant, it spreads more rapidly and potentially could lead to more severe illness. In the case of the B.1.3.5.1 and the P.1 variants, they spread more rapidly, but haven't been shown so far to cause more severe illness. And thus far, in terms of the evidence that we do have, sounds like those people who have been vaccinated against the coronavirus do have some protection against all three of these variants. The tricky thing is, if someone has had COVID-19 in the past, is not vaccinated, they are susceptible to being infected with these new variants. So the studies and the data has shown right now that these new variants still pose a risk to people who have already had COVID-19 in the past. So that's another reason we want to be vigilant in our mask wearing and making sure we're getting as many people vaccinated as possible, because although you may have had COVID in the past, you can still get COVID if you get infected with one of these variants. We want to minimize the number of cases we're seeing in Rock County, and especially we want to minimize the number of people who are severely ill and having to go to the hospital with COVID infection. So the chart that I have up here is just an indication of how many specimens have undergone what's called genetic sequencing. And this is the process where we determine if the virus is one of these variant strains. So when someone is infected with COVID-19 and they are tested, sometimes these tests are submitted to the state lab of hygiene for examination, and they sequence these specimens and determine whether or not they're one of these variants or of kind of the previous or the quote unquote normal strain of the coronavirus. In terms of Rock County, we lie in the south central region, and these percentages are based on the number of specimens that have been sequenced to identify what variants they may be. So 2.3% of the variants that have been, or the specimens that have been sequenced, are among the B.1.1.7 variant in the south central region. 0.1% of the specimens that have been sequenced are the B.1.3.5.1 variant, and 0.1% of the specimens that have been sent for sequencing are of the P.1 variant. So these are still relatively rare when we're talking about how many test results have been sequenced. But if you look on the very far right-hand side, there have only been about just under 4,200 specimens that have been sent to the state lab for sequencing. So that means a very small number of the actual total tests that are being conducted in the south central region. So this is the region, it's not only Rock County, but a number of other surrounding counties. A small number of those test specimens have been sent to the state lab for genetic sequencing. In Rock County, we're averaging about anywhere from 7,000 to 8,000 tests being conducted over the course of a 2-week period. So a very small number of specimens are being sent to these labs for genetic sequencing. What all this means basically is that we have these variants in our community, and it is likely to, it's reasonable to assume that these variants are likely circulating in our community. If they have been identified, They are more contagious, so it is very likely that these variants are circulating. We just don't have the capacity right now as a state or as a nation, really, to understand the kind of magnitude of how many of these cases in our county are of these variants of concern. And to provide a little bit of additional data, so the State Lab of Hygiene has put out this report. This is from April 16th, so it's a week old at this point, but based on the variants of concern that they're looking at, what percent of these variants are being identified based on the testing that they're doing. So again, we're kind of in the South Central region, which includes a large number of counties in our region. But basically, this graph shows what percent of the variants of concern are represented by these different variants. So by and large, the B117 variant is the most predominant variant that we're seeing in our southern region. The B1351 accounts for a very small number of the variant spread right now, and the P1 variant also accounts for a very small number of spread in the cases that we're seeing. But we'll continue to monitor this data and provide regular updates as this report becomes available to see kind of what the burden of these variants is in terms of the spread of the disease in our community. One example that I'm aware of is in Michigan right now. They are seeing an overwhelming number of new cases being reported, where they're actually seeing higher case spread right now than they were in the fall. Even though the vaccine is out and they're taking a lot of different precautions, they have a universal kind of statewide mask order. What they were seeing is an overwhelming spread of the B117 variant. So we have an example in Michigan, a close neighbor to us, where there could be overwhelming spread of a variant despite all of our efforts in terms of mask wearing and vaccination and things. So just kind of reiterates the point that we want to make sure that we're continuing to wear our masks and social distance as long as these variants are circulating, because these are going to be more contagious and potentially cause an uptick in cases. So that's all the information I wanted to share for our stream today. I'm going to stop sharing my screen and just take a look at the chat box and see if there are any questions. And let's see. Looks like no questions. So again, if you do have questions, you can always reach out to us via social media. Thank you for joining today. If you have questions and you want to see future topics covered in these future videos, feel free to let us know. In the meantime, we'll be joining you in a couple weeks from now. So everyone stay safe and healthy, and thank you for joining today.